So we have another question, and this is one about off-label prescribing. So how would off-label prescribing be managed? For instance, if it was prescribed for harm reduction rather than smoking cessation?
So under the Special Access Scheme and the Authorised Prescriber Scheme, the prescriber by law is required to only prescribe within the indications that have been approved for the authorised prescriber or the Special Access Scheme. So this is unlike a registered product. So if a product is approved by TGA, then it's up to the doctor working within appropriate legal. So it would be illegal, for example, even though it's off-label, to prescribe large amounts of opiates to babies. That would be terrible medical practice, and they'd probably end up facing legal action. When it's an unapproved product, they actually are only allowed in law to prescribe according to the indications, in other words, smoking cessation. And that's the pathway we see now, because there are no approved products.
Okay, thank you. I think this question probably has been somewhat touched on in the presentation, but perhaps worth explaining again. And this is about the requirements to become a wholesaler to supply nicotine-containing products.
So thanks, Dr. Finner. So the requirements are set out in state and territory law, and more or less this is something obviously that is more than something for the states and territories to respond to. But our preliminary research has identified that at least one requirement of that is that the applicant must demonstrate that they are a fit and proper person. Quite exactly what more is required, I'm not sure.
It varies by state and territory, but it's a long-established process. There's several hundred companies in Australia, in every state and territory, that have gone through this process. Again, it's not an arduous process, but we will, again, once we get a clear view as to whether this is all going ahead or not, we would put up the links to where you would apply for those permits on our website. But it's a well-established process. Most companies that are involved in the pharmaceutical side can do it in their sleep, but we realise there may be companies that have specialised in nicotine, vaping products, and obviously want the commercial and pharmaceutical opportunity. For those companies, we will put up the information. It does differ. You've got to love Australia, but it differs a bit in every state and territory. So that's why we can't say, and here's a one-size-fits-all. But the general principles are, they will check your criminal record and the business records of your company. They'll want you to maintain the things under secure, lock and key, because they are considered pharmaceuticals. And it will check a few other things about your business. And I think there's a small fee that has to be paid annually.
The other requirement, John, at law is for compliance with the Australian Code of Wholesaling Practice for Medicine, which we actually publish, and that is actually part of the requirements of the state and territory law as well.
Okay. We have a comment here, but perhaps in its back, it's regarding the nicotine concentration. I thought probably worth raising it in terms of a comment that pure nicotine is highly dangerous and should not be handled by the general public, reinforcing, I guess, that question earlier about the concentration limit.
Yeah, I don't think there'll be any pharmacies selling pure nicotine to individuals. If a company, for example, wanted to import concentrated nicotine and then make their own Australian range of products that are being diluted, this would be a matter as part of their pharmaceutical wholesaling licence. The same way there are companies, for example, that import concentrated opiates and so forth and do local, actually that's changed now, they used to do local tableting, adding fillers and so forth to the tablets. So those sort of things are covered off in the pharmaceutical law, but we don't expect your corner pharmacist to be selling pure nicotine. The concentrations go up to about 42 or 36 milligrams per mil, which is different from 1,000 milligrams a mil.
And I think to that point too, one of the things that the delegate has asked for, which can help with any accidental exposure to, is whether or not we need to look at childproof packaging.
For the diluted materials.
Well, that is predominantly, obviously, for kids, so that they don't get accidental access. We know that will make it harder to get accidental exposure across the board for anybody as well.
Okay, and this probably follows on nicely from that, is a question about whether pharmacies will be able to supply nicotine shots designed to be added to nicotine-free liquid purchased from a vape shop, or whether they will only be allowed to supply ready-made vape liquid.
That is still something, by nicotine concentrate. That is still something to be finalised in the final decision. Again, the trade-off is this balance between wanting to not limit people who might want to try a range of different strengths or even a range of different products for smoking cessation with broader safety issues. And so whether they end up only being able to sell the end product to user is again something that will have to be considered in the final decision. So there's a very good reason why this long-established process for decades has been an interim decision, which is then often tweaked. You know, if it does go ahead, it's often not just verbatim the interim decision. It's tweaked considering these sorts of inputs, and we encourage people to put these considerations in their submissions over the next 4 weeks to the TGA.
Okay. We've still got questions coming in, but they are starting to slow down a little bit. But I'll keep going. So we've had a couple of questions about the process of getting a product registered on the ARTG. So questions about who is the right person to talk to, and considering that, the data requirements, would they be the same level as typical prescription medicine applications, given that it would be Schedule 4? So perhaps just a little bit more.
So they would be like prescription medicine, but as I said, they can be literature-based. The challenge we have is the literature is not particularly comprehensive on smoking cessation. There's a couple of promising studies, but there's also one of the problems with a number of the studies in the medical literature about e-cigarettes and smoking cessation is, in some cases, have only followed up people for 6 or 8 or 12 weeks. But all of you who have tried to give up smoking will know that that's not really long enough to check that it's a sustainable smoking cessation. So the requirements will be for the clinical evidence, the manufacturing evidence, and also, again, the safety evidence can come from the literature. I would suggest if there are companies that are interested in that, they use that address that we've given already, the scheduling one, and we can then involve the right people in our prescription medicines branch and set up a teleconference. We're very happy to have a teleconference with any company that is interested in exploring that potential pathway, even if they don't go ahead in the interim.
And John, can I just add to that too? The TGA actually has a service that we provide specifically to organisations that are not familiar with our regulation, called SME Assist. And if you do go to the TGA website and type in SME Assist, it'll take you to pages that will actually help you understand the journey you need to take to actually put an application to us. And timing-wise, we're actually running a workshop at the end of October. So if you look on the website, we're running a specific workshop that will actually assist with the basics.
What's the subject of that?
So it's the basics of regulation, and it'll actually be a good starting point for organisations who aren't sure where to start if for the first time they're looking at supplying therapeutic product and want to know how to set about going through an application process.
So just go onto the TGA website and type in SME, which stands for Small and Medium Enterprise, SME Assist, and you'll find about the workshop, which I guess, given COVID, will be yet another webinar.
It will be a webinar.
Yeah, we do face-to-face workshops, and we hope to resume them in 2021.
Yeah, but they'll get to see me again.
Okay, I think the questions are still slowing down, but we've got a few to go through. So this one is about what would happen where there's no local pharmacy nearby. So, and there's a related question about, I guess, vape shops being able to supply, or getting licensed to supply. So can products be sent via Australia Post from a pharmacy to a consumer?
Well, there's really two questions there. To the first one, the answer is yes. And already, of course, in Australia, and you can type in the name of one of the big chains, Chemist Warehouse, for example, and Terry White, they do online pharmacies where you can either send in a script, or under COVID, there's now a range of new ways of transmitting scripts electronically where you don't actually have to find a postage stamp, if anyone still has any of those things in their drawer, where you don't have to actually physically send a script in. That's increasingly being adopted, triggered by COVID. So you can get, if you're, say, in a rural or remote area, or you just don't have a pharmacy near you, you can send off a script either virtually, and again, I won't describe the whole system of how to send off images of scripts and so forth, to a pharmacy, an online pharmacy, and have the materials sent to you. And remember, when I'm talking about the materials being sent for you, we're not seeing this as brand new pharmaceuticals being manufactured from scratch. Our evidence that we have to date is that many of the existing e-cigarette liquids that are out there in commerce already would be quite suitable for dispensing under one of these prescriptions. So it's not having to start a whole new manufacturing industry. It may well be that in the years to come this will trigger more Australian local manufacturer of e-cigarette liquids. But at the moment, as we all know, there's any number of companies in North America and Europe and New Zealand who are able to supply. Now, to answer your second question, because it's a prescription medicine, you need to be a pharmacy or a pharmacist legally able to dispense this product. So a standard vape shop will only be able to do what they've legally been able to do all the time, even now, and that's sell non-nicotine vape fluids, as well as selling the vaping equipment. They won't be able to sell nicotine unless if they're a pharmacy. But I remind them that they're not legally able to sell nicotine now.
Okay, I think that answers quite a few people's questions that have come through.
Well, we don't have to go the full 2 hours.
No, we don't.
Yes.
We don't. I have a couple more that we probably haven't touched on. So if you're happy to keep going, I'll ask a couple more. There's a few questions here with regard to the harm reduction and just querying whether harm reduction might be considered alongside smoking cessation, and noting that that some Australian vapers are using the e-cigarettes for harm reduction.
This will really be a discussion between the individual and their doctor. So people go on, I think most medical practitioners would be keen to see individuals eventually reaching an endpoint of being off nicotine, because nicotine is not great stuff. It's still, there's a reason why in law it's a dangerous poison. And so the ideal endpoint would be nicotine free. We realise that e-cigarettes are less harmful than combustible tobacco, and in the discussion that an individual will have with their doctors, it'll be about the trajectory. Some people may need to be on nicotine e-cigarettes for a longer period. Some, it's a bit like the cold turkey thing. Some may say, look, I reckon give it to me for 3 months and I'll get off this. So that will really be the discussion between the individual and the doctor. But the public health policy outcome and the general health policy outcome is to have as many Australians not using nicotine because nicotine is quite a harmful substance.
Right. I think that certainly clarifies there's quite a few questions on that. So I've got another question here regarding importation for personal use and just asking whether that a consumer would need to submit their prescription to an overseas supplier when importing for personal use, or whether they would be expected to keep it on hand.
We'll describe the process. Again, all the stepping stones haven't been built because the final decision hasn't been made and we didn't want to jump the gun. Generally, there's two approaches. Often people will submit an image, a good copy of that prescription to the supplier and say, here's my copy. They hold the prescription, and then if, let's say, Border Force open the parcel and they think, is this prescription dodgy or not, they then can ask for the original prescription. But generally, individuals have been in the habit of submitting a copy of it, so they hold the original. But again, if this goes through to a final decision, we'll put very specific, clear information on this process out both publicly on our website, and also we'll be running both consumer awareness and together with other groups in government education and information sessions for doctors and for pharmacists.
I think the important thing to understand with that is irrespective of whether the supplier overseas asks for that prescription or not, because of legal requirements in Australia, if asked, then that individual will have to produce the original, and generally that will come through, say, being picked up by border force.
Okay, I think we're starting to come to the end of the, we've had a lot of similar questions come through.
And we can answer, we will put up general Q&As based on the various sessions, and if there's very quirky questions, we can also try to answer them.
So let's just take one more then, and then I think after that we'll wrap up. Yeah.
So this question is about the vaping device, not the nicotine.
Yep.
And it's noting that you had mentioned there was no plan to regulate the devices. It's a question about why that is the case, given that they're delivering a prescription medicine.
In law, there's a very simple answer to that in law. Because they can be used to deliver other substances, our advice was that they're not, therefore, in law, a medical device. So you can use a vaping instrument, and if you're buying vaping liquids legally from an Australian source and the instrument, you're using it for non-nicotine. So because they can be used for non-nicotine vaping and other potential vaping additions, they are not considered a medical device in law. And good regulation is not trying to regulate things that are outside your legal coverage. And so we, again, will leave it to either the vape shops themselves to make sure that the products they sell are of good quality. And I think in general, while in the early days of vaping, there were a number of ones that blew up and so forth, the quality of vaping devices as the industry has matured has improved. But if there are particularly problematical ones, again, under Australian consumer law, under the ACCC, they can be picked up and prosecuted. And I mentioned we work very closely with the ACCC.
That's great.
Great. Thank you.
Probably we can wrap up.
Well, thanks everyone. We will wrap up, and there is that email address which I'll try to bring up again. If either you feel your question hasn't been answered, well, if you feel your question hasn't been answered, don't worry, because we actually we've captured every question that's come in.
We have.
We have a computer record of every question that's come in, and as I've said, we will, after this series of sessions in about a week or so, be putting out some Q&As. We'll be combining questions that are similar, so otherwise we'd be answering 120 questions, many of which several times. But if suddenly you feel there's something quirky or different, or you just think, oh gee, I should have asked about this, please send your questions to this address. It would be handy in the title of your email to put question following nicotine webinar or vaping webinar or something like that, because we get a lot of traffic on this email address.
And I think on that point, John, again, if we get inundated, we may not be able to respond to every question.
Oh, no.
But we'll try and ensure that the Q&As on our website address any of the questions that come through even on that.
We'll try to cover the range of topics. Yeah. So clearly if we get a question saying, well, where can I buy this in Broken Hill? We won't be able to answer that right now. But if it's a question that relates to the regulation of these and what it would mean for writing a prescription or whatever, we'll attempt to answer it, especially ones that are going to be of broader interest. So thanks again for your attention and time today. And again, the submissions close on the 6th of November, and we look forward to receiving your submissions. Have a good afternoon, everyone.
Thank you.